Welcome! Thank you for being here. The Joint Academy program is run by St. Vincent Hospital in collaboration with your surgeon's office. My name is Emily Hutchinson, and I serve as your navigator on this joint replacement journey. Thank you for choosing St. Vincent Hospital for your joint replacement. The Joint Academy program at St. Vincent Hospital is a unique program that was designed to meet the needs of the joint replacement patient throughout the continuum of care from pre-op to post-hospitalization. Our goal is to provide our patients with the best quality of care, including education, treatment, and discharge planning. This essential class is where we educate and prepare our patients as well as caregivers for a successful surgery and outcome. Studies show that patients who are physically and psychologically prepared for surgery tend to have better surgical outcomes, decreased fear and anxiety, as well as improved awareness of post-surgical lifestyle changes. To begin, a little housekeeping. St. Vincent Hospital has partnered with a third-party company called CareSense to help us complete Massachusetts mandated insurance, preoperative and post-operative surveys regarding your procedure. If you receive the below examples in the form of an email or a text message to your phone, it is safe to click these links and complete your survey. Not to worry, if not completed by your surgery date, it will be completed in the hospital. Our presentation agenda today includes discussing patient and caregiver education for a successful joint replacement outcome, treatment, and discharge planning. You can watch this video as many times as you'd like, and feel free to share this with friends or family who may be helping you post-operatively. To jump right in, let's talk about support systems. Having a support system in place during this process is very helpful for multiple reasons. A support system can be helpful before, during, and after surgery for up to a few weeks. Support systems can include friends, family, neighbors, church members, home health aides, and anyone else you may trust. You want to consider things ahead of surgery, such as setting up rides to your outpatient physical therapy, because you won't be driving yet when that begins, or having someone stop by to help with pets, laundry, groceries, or any other activities of daily living while you're adjusting to your new joint and recovering from surgery. One important thing to do before surgery is create a recovery-friendly space to come home from the hospital to. This is a great opportunity to put that support system to work. Be sure to have a chair with arms and supportive pillows to support safe mobility post-operatively. Additionally, consider keeping a table nearby, with a light or lamp within reach, to avoid unnecessary bending or twisting. Remove throw rugs, small objects on the floor like shoes or pet toys, as well as any electrical cords to avoid any potential fall hazards. You'll be going home with a two-wheeled walker, and you want to make sure your recovery space is walker-friendly. Pre-admission testing is an important visit in your joint replacement journey, as this is the group that will help you determine which medications to stay on, pause, or stop before surgery. Additionally, the pre-admission testing group is reconciling your medications to reproduce them while you're here in the hospital with us. A helpful trick is to create a note card listing all of your medications before this appointment. Include the dosage you take of each medication and the frequency in which you take the medication. Additionally, include any daily supplements or vitamins. Review this slide for location and further visit details. When you attend your pre-admission testing appointment before surgery, you will leave with a goodie bag that includes pre-surgical scrub and pre-surgical Ensure, together with a book from Joint Academy. Please refer to this slide for specific directions regarding scrub and Ensure use, or refer to page 17 and 20 of your book. Kindly note, if you are attending pre-admission testing with your primary care physician, you will not receive this goodie bag. It's okay to increase clear fluids in place of pre-surgical Ensure. The daily consumption of alcohol on a consistent basis leading up to surgery can affect your recovery. It is best to stop alcohol consumption on a daily basis before and after surgery. Alcohol withdrawal can cause serious health risks. Further, smoking puts you at a higher risk of infection and other post-op complications such as decreased healing and reduced circulation. Have an open and honest discussion with your surgeon prior to surgery if you struggle with alcohol or smoking. St. Vincent Hospital is a non-smoking facility. However, nicotine patches can be provided as part of your post-operative care, if needed. Here are reasons you should contact your surgeon's office in the days or week leading up to your surgery. If you are experiencing any type of new or active infection, including but not limited to respiratory, sinus, urinary, or dental, or an onset of a new illness such as a cough, cold, COVID, GI upset, etc., please let your surgeon's office know in advance. Additionally, if you experience any changes on the skin of your surgical leg, such as rashes, scratches, scabs, or wounds, it is imperative to let your surgeon know before surgery. If you are staying overnight after your surgery, please refer to the below packing list created for your convenience. Please be sure to label everything you bring with your information. In pre-op, the nursing team will help list your items on an inventory form. Sneakers with a closed back are a must-have item. A Joint Academy secret I'll share with you is that earplugs are also a must-have item. Kindly note that St. Vincent Hospital is not responsible for lost or stolen items. With that, please be sure to label your items heavily. Please do not bring any physical medications into the hospital from home, including over-the-counter medication like Tylenol or Advil. Important to note, don't bring assistive devices into the hospital on the day of your surgery. If you own your own two-wheeled walker, it just needs to be in the car of your ride home. If you don't own your own two-wheeled walker, we have them available to use while in the hospital, and we can send you home with one billed to your insurance as durable medical equipment. Wheelchairs are available for use at the 3 North Greeter Station if needed. Lastly, do not wear makeup, jewelry, lotion, nail polish, perfume, or deodorant the morning of surgery for your safety. You will receive a phone call the business day before your surgery to let you know what time you should arrive to the hospital on the day of your surgery. If you have a Monday surgery, you will receive a call on the Friday prior. If you do not receive a phone call by 5 p.m., please refer to page 20 of your Joint Academy book or the phone numbers listed on the slide below to call same-day surgery for your scheduled time to arrive. The below slide details what to expect for your surgical stay timeline. Be sure to arrive early to Suite 310 South for check-in and have your copay ready, if applicable. To prepare yourself best for pre-op, please refer to page 25 in your Joint Academy book, where you can learn about your different anesthesia options. Average length of stay in the hospital is 1 night for this elective outpatient procedure. However, this can vary depending on individual medical needs. Most patients do well after surgery and are up and walking, ready for discharge the day after surgery. When you're out of surgery, you will be moved to our post-anesthesia care unit to monitor you until you are stable to transfer to the hospital floor. If you stay overnight, the discharge expectations are that you must have a ride available to pick you up at the hospital by 11 a.m. on the day after surgery. If you are part of the GRP program or Joint Advanced Recovery program, then your surgeon has determined that you meet specific criteria to anticipate discharge the same day as surgery. The decision to be in the GRP program comes from your surgeon. If you are in the GRP program, you must have a supportive caregiver at home for the first 48 hours. Additionally, you must have a ride home same day as surgery by 5 p.m.
To begin the surgery, your physician will make an incision in the skin over your hip joint, cutting through the skin, soft tissue, and muscle to access the hip. Once the hip is reached, the ball is dislocated from the socket and removed from the end of the femur with a saw. The socket, or acetabulum, is exposed. After measuring the size of the socket to guide accurate selection, the appropriate reamer, a cheese grater type device, is used to create a perfect hemispherical bone socket that matches the external shape of the acetabular cup. The cup is carefully positioned in the bony socket. This cup is held in place using a number of methods depending upon surgeon preference and your bone quality. These methods may include bone cement to hold the cup in place. Most cups are designed to allow bone to grow into the metal surface to hold the cup in place. These cups have a roughened or specially prepared surface, which is designed to allow ingrowth of bone into the metal itself. This type of fixation may be augmented by screws to help fix the cup in place while bone growth takes place. The inside of the femur, or thigh bone, is then cleared with various types of devices, and a prosthesis is placed into the femur. A trial ball is placed on the top of the femoral stem, and a plastic insert is placed into the cup. The hip joint is then articulated by placing the ball in the artificial socket. The hip is evaluated for the type and amount of motion it has and the stability of the joint. That is, the inability of the ball to dislocate from the socket easily. Once the appropriate combination has been found, the ball is then placed onto the femoral stem and the final insert is placed into the cup. The leg is evaluated again for stability and mobility and leg length equality. Throughout the operation, numerous measurements and operative considerations are taken to equalize leg lengths. However, the primary goal is to achieve a stable, non-dislocating hip. Prior to final assembly of the total hip, leg lengths are again evaluated. The new implants will replicate your hip joint. Your physician will rinse out debris from the hip joint with sterile fluid and then close the wound in layers with stitches and/or staples. To begin the surgery, your doctor will make an incision on the front of your knee, cutting through the tissue surrounding the muscles and bone. The kneecap, or patella, is rotated to the outside of the knee to help your doctor see the area where the implant will be placed. With the end of the thigh bone, or femur, now exposed, your doctor will use special cutting instruments to measure and make precise cuts of the bone. The end of the femur is cut into a shape that matches the corresponding surface of the metal femoral component. This component is then attached to the prepared end of the femur. Next, the shin bone, or tibia, is prepared with a flat cut on the top. The exposed end of the bone is sized to fit the metal and plastic tibial components. The metal component is then inserted into the bone. A plastic insert, or bearing surface, is then snapped into the tibial component. The femoral component will slide on this plastic as you bend your knee. If needed, the kneecap, or patella, is also cut flat and fitted with a plastic patellar component. Your surgeon may choose to use cement to help fix the implants on your bone. Your doctor will conduct several tests during the surgery to ensure the correct sized components are used to help you regain good balance and motion in your knee. Your doctor will rinse out the debris from your knee with sterile fluid and then close the wound in layers with stitches and/or staples.
The below slide details what to expect, generally, following surgery. Please don't get out of bed or chair without assistance while in the hospital. You may experience common post-operative symptoms such as nausea, vomiting, or dizziness, along with discomfort or pain. Although we cannot eliminate all pain, we can do a great deal to lessen and relieve it. With effective pain management, you can regain strength sooner and participate in activities of normal living quicker. While in the hospital, it is important that you advocate for yourself and communicate the level of pain that you're in. We want you to be in the 4 to 6 range on the pain scale because this indicates tolerable discomfort that would allow you to rest, eat, participate with physical therapy, and independently toilet. There are certain general post-operative concerns that your medical team will continually assess for following your surgery. As an active participant in your own care, you should also be aware of these risk factors and perform self-management. Please refer to slide below for more information. Talk to your dentist and surgeon if you have routine dental work scheduled within 3 months after your surgery. After 3 months post-op, talk to your dentist or surgeon about preventative care to maintain a safe and healthy new joint. VNA Home Physical Therapy is arranged by the Joint Academy Program Coordinator based on proximity to home/recovery location and insurance authorization acceptance before you come into the hospital. Home care generally begins 24 to 48 hours after hospital discharge, and your agency information will be printed on your hospital discharge paperwork. Expect 1 to 3 home PT visits before you are able to safely transition to outpatient physical therapy. Some special cases may require transition from hospital direct to outpatient physical therapy. You will be notified by Joint Academy Program Coordinator if you should go direct to outpatient physical therapy. A case manager or discharge liaison will see you after surgery and will assist in your discharge planning if you become an inpatient in the hospital. Case management will assist with setting up short-term rehabilitation if clinically indicated following surgery. Please note, living alone does not qualify you for short-term rehabilitation. You must qualify clinically, and this decision cannot be made until after surgery. It is the patient's responsibility to understand their individual insurance coverage related to their surgery and post-operative care appointments. Your surgeon's office will submit and confirm insurance approval for the surgery, but you may be responsible for copays or deductibles. You may receive a letter or phone call from the hospital at least 7 days prior to your scheduled date of surgery with your financial responsibility. If you have a copay or deductible, you will have the option to pay over the phone or on the day of surgery. You may call the SVH Patient Service Center at 508-3636-211 with questions. Coverage for post-op care, home health, outpatient PT, inpatient rehabilitation, and durable medical equipment is not part of the surgery insurance approval process. It is strongly recommended that you call your health insurance company prior to surgery to understand your out-of-pocket costs. Refer to page 10 of your Joint Academy book for more recommendations. Frequently, after a knee replacement, patients may experience muscle tightness or spasms. It is beneficial to reposition, stand up, or walk to alleviate this feeling. Make sure to complete all exercises and stretching as recommended by your physical therapy team. When resting, place pillows under your foot or ankle, not under your knee. There may be a pulling sensation at first, but this will dissipate with time. Ice your knee with your ice machine several times each day to help reduce swelling and pain around the surgical site area. This ice machine circulates cold water through a pad that is applied around the knee. A Joint Academy hack for this machine is to freeze 8 16-ounce water bottles before surgery. 4 fit inside the machine for longer-lasting cold therapy. Always keep a barrier between the ice machine and your skin. Frequently, after a hip replacement, patients may experience muscle tightness or spasms. It is beneficial to reposition, stand up, or walk to alleviate this feeling. Patients with hip replacements will need to place ice packs against their surgical hip. It is recommended, not required, that patients buy reusable gel ice packs to use at home. A Joint Academy hack is to buy 2 gel ice packs so that when one is in use at home, the other is cold and ready to switch out if needed. The ice packs should be a large enough size to cover the hip area. Always keep a barrier between the ice pack and your skin. To summarize the 3 phases you will go through on this joint replacement journey, the first phase begins in the hospital. You can expect to be seen by hospital PT same day as surgery if you are in the JARP program, and next day if you are staying overnight. In order to clear to go home with home PT services, you must demonstrate transferring in and out of the bed and/or chair, walking with the 2-wheeled rolling walker, and stairs with the 2-wheeled rolling walker, both independently and safely. If you are not able to clear with physical therapy, you may discuss other discharge options or recommendations with your hospital physical therapist. The second phase begins at home. A visiting home physical therapist will perform an evaluation after hospital discharge and may come 1 to 3 times before you are discharged to outpatient physical therapy. Your home physical therapist is within their scope of care to perform incision care with you if needed. The third phase begins at an outpatient physical therapy clinic of your choice. You should be seen by outpatient physical therapy 2 weeks after surgery. You will need a prescription from your surgeon for outpatient physical therapy. Remember to pre-plan for this phase by arranging rides to your first several outpatient physical therapy appointments, as you will begin outpatient physical therapy before you are seen by your surgeon and cleared to drive. Additionally, it is important to identify the clinic you want to use and set up your appointments early on, as they do fill up like other doctors' offices. The length of outpatient physical therapy varies person to person, and the expectations are set by the physical therapist together with your surgeon. Here is your new Cadillac after surgery. This is the specific model rolling walker that your surgeon has prescribed for you post-operatively. Hospital physical therapy will teach you how to properly use this device while walking or navigating stairs. This is required medical equipment that the hospital can provide and bill to your insurance as durable medical equipment. A Joint Academy hack for this is to check your local senior center. Oftentimes, they have 2-wheeled rolling walkers for free or loan. The below are optional durable medical equipment options, only available through your insurance company or various pharmacies/retailers. These items are especially helpful if your activities of daily living are a challenge before surgery. Before you go home, your surgeon or nurse should explain everything you need to know about taking care of your incision. Make sure you understand how to care for your incision before you leave the hospital. Be sure to purchase appropriate dressing supplies before surgery so they are ready when you get home. You will need 3x4 or 4x6 non-stick sterile pads and medical tape. Most patients will have glue over their incision, but some will have staples. It is important to follow discharge instructions for directions specific to you. General dressing rules include no baths, swimming, or using a hot tub until cleared by surgeon. Always perform hand hygiene before and after dressing changes. Nutrition plays a big role in our body's ability to heal and recover. Increase your fiber, protein, and carbohydrates, along with fluids following surgery. For your convenience, you can ask your surgeon to send your prescriptions to Essential RX Pharmacy, located in the hospital on 3 North by the entrance. Prescriptions can be ready for you at time of discharge from the hospital, avoiding the extra stop at a pharmacy on your way home. Call to pre-register before your date of surgery 508-363-6602. If using a pharmacy outside of the hospital, be aware of timing, hours of operation for scheduled medication continuance. Additionally, be sure to advocate to have medications ready same day as discharge. Defer to your patient discharge instructions for medication schedule. Having a joint replacement is an appropriate time to use prescribed narcotics or opioids for short-term pain management. It is extremely important to slowly decrease the amount of narcotics you use over time to avoid opioid dependence. Do not drive work, or consume alcohol while taking narcotics. Do not hesitate to reach out to your surgeon with questions or concerns over the use of narcotics. The most anticipated question is, when can I drive? You must be cleared by your surgeon at your follow-up appointment, as well as off all narcotic medications before you can resume driving. The time from surgery to when you will be able to drive safely varies greatly. The timeline on when you will be able to return to work varies depending on the type of surgery you had, your recovery progress, and the type of job you perform. Your surgeon, along with your physical therapist, can assist you on making the decision to return to work. Our visitor policy is always subject to change. However, see below for our current policy in effect. Once you are home and settled, it is very important to review all of your discharge instructions, medication lists, and patient education materials that were given to you prior to or at discharge. Thank you for watching. Best wishes from Joint Academy on your upcoming joint replacement.